Hi, I'm Katie. I work for the adult CF clinic, and I also work inpatient at Maine Med, so I tend to treat a lot of the adults. I have met a few of the pediatric patients, but not many. Now that they have kind of gone over the more fun stuff, I get to talk about research. So I'm going to try not to bore you too much, but this is kind of where we get what we're talking about to you. The research is what drives us to kind of come to you guys and be like, this is why we should be doing this. So I'm going to start with the research on the exercise. One article by Ann Swisher and Mia Erickson in 2008 showed that regular aerobic exercise enhances cardiovascular fitness, airway clearance, and slows the decline in lung function. People with CF with good aerobic capacity have overall improved prognosis and increased quality of life. Benefits of exercise include delay onset shortness of breath, maintenance of bone density, enhanced immune response, and increased feeling of well-being. After doing their literature review, what they really want to know is how do adolescents perceive exercise? So they went and they did a study on 13 to 18-year-olds with CF, and the adolescents stated that they knew exercise was good for physical and mental well-being, and improved endurance and managed weight and builds muscle. What this age group found as a barrier to activity are physical discomfort, coughing, and overall kind of how the general public feels about exercise is you get bored. Parental influence has also been found to be a key indicator into an adolescent's exercise behavior. The adolescents in the study were less willing to admit that their parents had influence over anything they did, but they did show that, you know, if their parents exercise, they're more likely to exercise. So what to take away from this article is that enjoyment and satisfaction from physical activity are important motivators. It's important to find activities that are interesting to each individual. As Tammy was saying, it's important to have a wide variety of activities to prevent boredom. I know even me as an adult, I'm training for a 10K, but oh my gosh, do I get sick of running. So every once in a while I'll go out for a bike ride or I'll go for a hike, just something different to mix it up. Cough and shortness of breath are perceived barriers to exercise. However, regular exercise has been shown to decrease these symptoms. So while it may be uncomfortable in the beginning, it actually should improve with time. Kind of like anybody. If you go out tomorrow and you've never run before and you expect to run 3 miles, you're not going to be feeling well. So kind of the same thing. You want to start slow, build yourself up. It should, in the long run, actually decrease the amount of coughing and shortness of breath that you get when you exercise. So the next article is evidence regarding exercise training and management of CF. In a recent review of the literature on all of the exercise articles on CF, it showed that 5 of 7 studies showed that there was an increased peak oxygen consumption rate. So I'll talk about that a little later in the next article, but 6 of 7 studies showed that significant improvement in peak work rate, reduced lactate concentration, and decreased heart rate in CF patients who perform aerobic activity. So kind of as I was saying before, you get that training effect. As you work out more, you know, you're obviously going to be able to work harder. You're going to be able to decrease your resting heart rate, and you're going to be able to exercise for longer. So improvement in lung function has not necessarily been found as a result of exercise. However, exercise has been shown to have a preservation effect. So some people will start exercising and they'll be like, well, why isn't my FEV1 getting better? Well, it might not necessarily make your FEV1 better. What it does is that it actually preserves it so you can stay at your FEV1 for longer without having it drop. And 5 of 6 studies showed that there's an increased health-related quality of life. You know, they say these articles are basically based on CF patients. However, this can be true for the general public. You feel better when you exercise. It releases endorphins. It makes you feel like you can breathe better. So going back to the peak oxygen, this is another article called Peak Oxygen Uptake and Mortality in Children with CF. So peak oxygen uptake is also known as your peak VO2. It was shown to decline at a mean annual rate of 2.1 milliliters per minute per kilogram. And patients with a peak VO2 less than 32 shows a dramatic increase in mortality. So as your peak VO2 goes down, your chances of dying go up. So a higher peak VO2 was shown to be a marker for longer survival. In the previous article that I had just talked about, exercise was found to increase your peak oxygen consumption rate and preserve your FEV1, which are the two largest indicators of mortality. So as you exercise, you're actually, increasing your oxygen uptake and decreasing the decline of your FEV1, so it actually increases your likelihood of living longer. So use of peak heart rate reached during a 6-minute walk test to predict individualized training intensity in patients with CF. I threw this article in because many people don't know in pediatrics, but we perform 6-minute walk tests in the hospital with our adult patients. And we use the 6-minute walk test not only as an indicator of if you're getting better while you're in the hospital from admission to discharge, but also to set training intensities for when you do exercise. So it can give us where your heart rate range should be when you exercise. And they're actually, I think, talking about bringing this into the pediatrics as well, so that, if you do get your child to exercise and you want to monitor to make sure they're not working too hard or if they're working too little, you'll have this range and be like, okay, well, their heart rate is, 130. They're right in the range that they need to be in order to be getting the peak benefit from exercise. So this article showed that exercise tolerance is now associated with increased prognosis and survival. However, benefits may be influenced by intensity of exercise and adherence to the program. So if you're not exercising at a moderate enough intensity, the exercise may not be as beneficial as if you're not getting your heart rate up. So kind of as Tammy was saying with the Wii games, that if you're just doing bowling where you're not getting your heart rate up, yes, you're doing exercise and it's great that you're being active, but you might not be training your heart enough to reap the benefits of the exercise. And so the 6-minute walk test has found to be a submaximal safe test in patients with CF to determine proper exercise intensity. And what they mean by submaximal safe is that they're not having you go to your maximal heart rate intensity, which can be stressful on anybody. So heart rate max demonstrates a satisfactory test-retest reliability. So when they do it over and over again on the same people, you're going to get similar results. And making this a simple method to individualize exercise prescriptions for people with CF. And this is actually something that I've been hoping to bring into the adult clinic as well, is that doing it when you're well has a better reliability on where you should be training than doing it when you're sick. But doing it when you're sick in the hospital is a really good indicator of how much, if you're improving after your exacerbation. So the take-home message from all the articles on exercise is that exercise has been found to improve prognosis and increase quality of life. Exercise may not increase lung function, but it can preserve it. It's important to start young and find activities that interest you. Exercise may cause coughing and shortness of breath. However, it aids in airway clearance and can reduce shortness of breath with training. And it's important to know your training heart rate range, exercise at an intensity appropriate for you, and adhere to a program. All right, and then a little bit of research on airway clearance. So one article is a routine airway clearance in asymptomatic infants and babies with CF in the UK. Should we be doing it or should we not, basically? And this is still a constant debate. One side of the argument states that rates of non-adherence to prescribed treatments in chronic diseases are reported at about 50%. So if you have a chronic disease, you may or may not adhere to your program about 50% of the time. Or 50% of people adhere to it and 50% of the people don't. The poorest adherence to treatment regimens is associated with time-consuming intervention, which airway clearance and exercise are often considered to be, time-consuming things that a lot of people, feel like, man, I just don't have time to do that today. And while inflammation is found in asymptomatic babies with CF, mucus may not be. And so what this statement is saying is that why do airway clearance if there's no mucus? So the other side of the argument, which you can see there's a few more points, says the efficacy of chest PT and CF has been demonstrated in adults where withdrawal of this treatment showed detrimental effect on lung function. And airway inflammation was present in infants as young as 4 weeks old, and studies have shown bacterial and viral pathogens in asymptomatic babies. So even though they may not be presenting with symptoms, they still have some bacterial and viral processes in the body that may be going on. Lung function in infants with CF is reduced soon after diagnosis, and the immature respiratory anatomy and physiology of infants makes them more susceptible to respiratory infection. They say that, since their muscles are still weak and maturing, they don't quite have the capacity to expel infection as someone who might be a little older. An early introduction of daily airway clearance can encourage adherence to treatment. If it's something that you're used to doing and you're doing it from the start, it's going to make you more apt to continue doing it, instead of 2 years down the road when your child has their first exacerbation and then you're having to learn it all over again. So in the next article, Spare the Cough, Spoil the Airway, Back to Basics in Airway Clearance. It goes on to say that cough is a defense mechanism used to clear secretions and foreign materials from the airways. Chest physical therapy is the standard, that's supposed to be by which all airway techniques are measured. In a study comparing the flutter or a cappella and chest physical therapy, improvements were noted in both groups. So in a 6-week study comparing the vest, the flutter, and chest physical therapy, there was no significant difference between the therapy types. They all show improvement. So in the next article, Finding Evidence to Support Airway Clearance. Airway clearance techniques aim to resolve excessive bronchial excretions, reduce airway resistance, and improve ventilation short term. And in the long term, removal of the mucopurulent secretions may reduce the progression of damage to the airways and impairment of the mucociliary clearance. So active cycle breathing has been shown to have a beneficial effect in secretion clearance and lung function, and significant increases in FEV1 and forced vital capacity were also reported. So these articles, basically, I just wanted to find a bunch of articles that covered all of the airway clearance techniques that there are out there. And so this article here shows that autogenic drainage, when compared to active cycle breathing, showed no difference. And studies to date do not answer the question of which technique is best. The immense problems with patient adherence limit the research in this area. So the biggest limitation basically to airway clearance is people adhering to it, not necessarily what type you use. So the take-home message is, beginning a daily airway clearance routine in asymptomatic infants has its pros and its cons. There is no one best airway clearance technique. The most important thing is to find a technique that works and to stick to it. Adherence and proper technique are the keys to effective airway clearance. Basically, just do it. Find something that works for you. Find something that works for your family. If it's, using the vest, it's very easy to combine a lot of these treatments. If you're going to be doing nebulizers anyway, it's easy to do them with an acapella. It's easy to do them with the vest on. And some people actually even do it during chest PT. So combining therapies is a great way to save time and make it work for you. Did we want to show that, or what time is it? It's too short. Okay. Well, so there's one thing that we wanted to show you as a group that Jess actually found, is that on the CF Foundation website, there is a link to, it's underneath CF Lung Health anthologies. If you type it in under in the CF Foundation website, if you type it in the little search box, look for exercise anthologies, it comes up with a little 12-minute presentation on CF and exercise. So it kind of has a, what is it? It's a PT and a CF patient. Okay. And they go through like postural exercises and things to do, different ways that you can do exercise. So it's actually a conversation between a patient and a physical therapist on things that, other ideas that you can do at home.
Good demonstration too, so you can actually see people doing it.
Yeah, there's no volume, so we can't play it. Any questions?
Can you ever replace any of these airway clearance techniques that you discussed with intense physical exercise? For example, I have a soon-to-be 11-year-old. She's very active, and say she will typically run a lot of like 5Ks and things like that with me. And if she does do that on a given day, could you not do PT that day?
I hate to say yes or no because there's actually no research on that. There's no research to say that exercise can overtake airway clearance. And a lot of that research we actually can't do because it's considered taking away treatment if you're taking away airway clearance techniques. What I have personally found is that people who are very active tend to have better airway clearance with their exercise than others. As long as, I always say, as long as you're doing something, it's better than nothing. And if she's coughing and raising and she's able to clear her mucus with exercise, I'd consider it beneficial.
I will, one comment I have we had one patient who was very active, very physical, hockey player, and I think what happens over time, it worked for him, just the activity, but after a while, he was finding that he was coughing a lot during the activity, and if you may find that if she does airway clearance, it will clear some of the secretions, so she will actually have better performance with the activity. Because I think sometimes if you have a lot of secretions, it will actually get in the way of, you know, how much you can do with it, especially if you become very competitive.
Right, I wouldn't replace it, but just
Yeah.
every once in a while, so very sporadically, could that,
I think
just
if you,
from a time perspective?
I think if you
very
do
busy?
one airway clearance, the second one could be in, you know, if it's intense activity, it could be like that. I would do airway clearance at least once a day, though. Personally, I think we should.
And the other issue that can come up is that if you feel like you're replacing with exercise a lot, is that you get out of the routine of doing airway clearance. And as you get older, if the lung function does decrease and you start having more mucus buildup and you're not in the habit of doing airway clearance, it's much harder to kind of get into it. Yep. Any other questions?